I said to the social worker, when is it appropriate to bring up a personal story? And she said, well, in my opinion, it's when it is meant to serve the other person and not serving you, when it's not about you. And so I said, okay, is it okay if I go back in there and talk to her about my experience? And she said, sure, let's go back in. And I said, hi, I'm a Georgetown student too. I got really sick my sophomore year and I was terrified as well. But my dean was so helpful. My dean was like about to pop pregnant, and she came to the hospital to see me because luckily it was just right across campus. And she said, we'll do whatever you need to take care of yourself, to get healthy. I was able to withdraw and everything, and I withdrew again and then took off a whole year. They were so supportive, but I was just real with her. And I said, they're there. They can support you. And she said, thank you so much. And I learned that she was going to get treatment and, and talk to her dean. And just the fact that sharing my story could help her in that way to prioritize her health and realize that's most important and ultimately will allow her to be able to go back to school and be healthy, that just meant so much to me. And just to know that revealing these vulnerable parts of our experience can help other people is why I do what I do. Because so many of us are not seen or supported or empowered, or there's a lot of gaslighting. And just to know, hey, I have been here. This is what you need to do to advocate for yourself, but they're going to support you. That was a real kind of turning point for me, and realized, okay, this is what I want to do.